So in continuation of the overview of the liver, the last session seen in detail about the anatomy and physiology of liver. And today we are going to see the diseases and its perspective as per the modern medicine and also as per the TCM. So what are the patterns that cause various diseases and all? Whatever the no doubts and clarifications that you need, you please reserve that. At the end, we will discuss. So with regard to the diseases, we have seen the major common the diseases, around 6 diseases, that is cirrhosis, hepatitis, fatty liver, jaundice, liver failure, and then liver cancer. Of these, fatty liver is a very, very common one. If you see, out of 100 patients, not patients even, general persons, those who are for some other reasons go to get their abdomen scanned, at the time only they will get to know that they have got the fatty liver. Most probably the grade 1 and all, it would be a shock for them to know that they have got fatty liver. So what is fatty liver? It is a condition where the excess fat that builds up on the liver. There are two reasons which trigger this fat building up on the liver. One is because of alcohol consumption, continuous. Second one, which is nowadays very common, is NAFLD, that is non-alcoholic fatty liver disease. Nowadays, this is very, very common. Previously, if someone is having fatty liver, first question we ask the patient is that, do you consume alcohol? And what is the frequency? What is the quantity every time? Nowadays, that is ruled out. The percentage of NAFLD, non-alcoholic fatty liver condition, is percentage is more than the alcoholic fatty liver. And there is no age, no differentiation also. Like after this age only, normally the persons may get. No. Even we have seen so many cases, youngsters, now for around 30s, they've got fatty liver disease. So first we will see the alcoholic fatty liver, AFLD. It is the damage of the liver which is caused by excess alcohol consumption that leads to the fat accumulation in the liver cells. So when the alcohol is consumed, liver fights very hard to detoxify that. Even if one drop gets in, that influences and it damages the liver, hepatocytes. So the chronic alcohol consumption, in some cases, genetic predisposition also will be there, malnutrition, obesity. The person who is obese and taking alcohol will have the probability of getting the fatty liver more. And if the conditions like hepatitis C especially, so if that is there, then the fatty liver occurrences will be more likely. So these are all the common causes that triggers the fatty liver. So it has got some stages. Stage 1, stage 2, stage 3, like that. That is simple fatty liver, that is steatosis, wherein the fat builds up in the liver, which is usually a reversible condition. when the alcohol consumption is stopped. Second is alcoholic hepatitis, where the liver is inflamed, inflammation of the liver due to alcohol, and this may cause the liver cell damages. That is alcoholic hepatitis. Then alcoholic cirrhosis, final, where severe scarring of the liver cells are there and it is irreversible. The damage is irreversible. So it is a serious condition. And the symptoms commonly, fatty liver normally, whether it is alcoholic or non-alcoholic, often it is asymptomatic. Especially in the early stages, you will not get to know that the fatty liver is there. As the condition progresses, worsens, what the patients may get is that general weakness will be there, fatigue will be there, and loss of appetite. That is the major symptom that one can suspect. Loss of appetite. Abdominal pain, especially right hand side. Then nausea. And in severe cases, where the hepatitis or the cirrhosis are there, then jaundice will be there, and hepatomegaly, enlarged liver, will be there. So normally how we can diagnose this is through liver function test to check SGOT, SGPT, bilirubin, ALP, alkaline phosphatase, then albumin, globulin. These are all be seen there in the liver function test. So we will check with that, and best is ultrasound, basic, to get to know about any fatty liver condition. And in case of fibrosis, cirrhosis and all, they go for fibroscan, or if they suspect, they go for biopsy if they feel that it's a cancerous one. So normally these are all the diagnostic tools that are available to understand or study about the prevalence of the fatty liver. In alcoholic fatty liver cases, first one is to stop alcohol consumption. That is very, very important. And nutritional support, and especially the vitamin supplementation, like B1, vitamin B1. B1 is thiamine. That is highly helpful. So what happens in the alcoholic fatty liver, if the patient again continues to take alcohol despite the doctor's advice, that will lead to liver failure or cirrhosis. Simultaneously, in addition to that, they will have the portal hypertension. So liver cancer, all those things will be definitely we can anticipate if the patient is not strictly following the advices. Avoid the alcohol consumption at all. In case of non-alcoholic fatty liver disease, where the fat accumulation is there, but it is not caused by the alcohol consumption. And who are all may likely have this non-alcoholic fatty liver condition is the person who is having type 2 diabetes, and then obesity. Already we have seen, I think in the last class, I've explained in detail about how the liver is involved in the glucose regulation, blood sugar regulation in the body. What is the involvement of sympathetic and parasympathetic nervous system, and how the liver reacts to that and what happens in that. So in case of type 2 diabetes, naturally the blood sugar will be more there, and the insulin pancreatic cells as well as the liver cells will be directly getting the impact of this. So that causes more of fat accumulation on the liver. And high cholesterol and triglyceride, if a patient is having the lipid profile not proper, cholesterol and triglycerides, they may also likely to have non-alcoholic fatty liver. Then obese patients, then PCOD, PCOS conditions. PCOD, it interferes in the insulin resistance mechanism. So wherever the PCOS or PCOD is there, the patient will likely have insulin resistance. Over a period of time, diabetes. Over a period of time, fatty liver. So the prognosis is like this. And the sedentary lifestyle, that also causes NAFLD. And poor diet, especially taking high fructose, processed foods, these trigger the NAFLD. So here also, well, there are two types. One is the common one, which is simple, excuse me, simple fatty liver, where the fat is present, but no inflammation or liver damage is seen. That is a simple fatty liver condition. So with proper diet, exercise and proper management, we can reverse this very fastly. Another one is that non-alcoholic steatohepatitis, NASH. This is a bit difficult one, where fat deposition is there, inflammation is also there, and liver cell damage also will be there. And this will progress to cirrhosis over a period of time. So this is a serious condition, that is NASH, non-alcoholic steatohepatitis. In non-alcoholic fatty liver also, if you see the symptoms, normally they will not get any symptom initially. So gradually, as the grade progresses from 1 to 2, 2 to 3, they will get the discomfort or pain in the upper right abdomen. And naturally, the fatigue will be there. SGOT, SGPT elevation will be there, the liver function test. And hepatomegaly will be there as the stage progresses. So in NAFLD, normally what we advise is, first, if the patient is obese, we will tell them to reduce weight. BMI should be brought near to around 27, 28, if not 25. 25 is the ideal one. So we will ask them to almost, if it is more than 30 and all, reduce that maximum possible. And the diet must be healthy and avoid sugar, and better to avoid carbohydrates. 80% of the cholesterol is made from the cholesterol, from the carbohydrates, not from the fat that what the person consumes. And the saturated fat to be avoided while taking. Then physical activity. The lethargy should be removed, and patient should exercise at least half an hour every day. So approximately around 150 to 200 minutes in a week is minimum. What the physical activity exercise is something. If the patient is having diabetes as well as hypertension, that is to be managed. And here, if the vitamin E deficiency is there, that is to be checked, especially in case of non-diabetic NASH, NASH. But before taking that, it's better to get the advice from the physician instead of they are taking their own. Anyhow, we should not advise all those things that you have to take vitamin E and all, but it supports. So, if it is unaddressed, especially the second one, NASH, what will happen? That will lead to the cirrhosis and or cancer. And most of the cardiovascular diseases, the death, one of the leading cause of the death in NAFLD is because of cardiovascular diseases and also the liver failure. As we have seen that the liver is involved in more than almost 500 chemical activities, metabolic activities. The fatty liver will interfere in the metabolism. So the increased risk of metabolic syndromes are there. So to just summarize about the fatty liver, that is, there are two. One is alcoholic, another one is non-alcoholic. So cause-wise, AFLD is because of alcohol consumption, whereas NAFLD is because of metabolic factors, diabetes, obese, PCOD, so metabolic factors. Whereas there is no link to alcohol in NAFLD. Early symptoms, NAFLD often it will be asymptomatic till it reaches some grade 2 and above, advanced stage of grade 2. And the progression, how it goes is steatosis and then hepatitis and then cirrhosis. That is how it progresses.
ಅವರು ಸುಮ್ಮನೆ ಕೊಟ್ಟಿದಾರಪ್ಪ ಅಷ್ಟೇ ಕ್ಯಾಲ್ಕುಲೇಟ್ ಮಾಡೋದು ತುಂಬಾ ಕಷ್ಟ. ವಿ ಡೋಂಟ್ ನೋ ವಾಟ್ ದ ಕರೆಕ್ಟ್.
With regard to the treatment, yes, both can be reversed. Both AFLD as well as NAFLD, both can be reversed with the proper lifestyle changes, with proper diet and proper management of it. And in case of NAFLD, first one is to address the metabolic aberrations, weight loss, in case of obese and PCOD or the other conditions and all, regulate that. And in case of alcoholic, first one is that stop the alcohol and then give some nutritional support. That is important. With regard to cancer risk, which is more, is alcoholic fatty liver is more high with cirrhosis. Whereas in NAFLD, it is moderate to high with NASH, that is steatosis. So, with regard to the points and other things and all, we will see about this when we get to understand about the TCM's perspective. Hepatitis caused by virus and A, B, C, D, these are all the categories of hepatitis. And autoimmune hepatitis is also there, and drug-induced hepatitis is also there. So it is because of the infection or It is within autoimmune or it is drug induced. And the symptoms are like jaundice, hepatitis. In severe cases and all, it's deadly one. So it should not be taken so lightly. Jaundice, fatigue will be there, nausea, all the liver conditions when it is in advanced stage and all, normally there will not be any appetite and the nausea will be there. Because of this, fatigue will be there and the urine will be dark. The feces, it will be light, pale, and there will be abdominal pain and they will have emotional disturbances. So, with regard to the management, depending upon the type, what is the cause of the hepatitis, it is to be treated. If it is because of virus, then definitely through antiviral drugs. In case of autoimmune, what modern medicine gives is steroids. Of course, for not only for liver-related hepatitis, but for generally any autoimmune condition, in advanced case, they choose to go with corticosteroids. Then a drug induced in the case, identify that and advise the patient to check with the person or the physician who prescribed that and accordingly let them take the call. So we should not advise anything on the drugs or medicines or other things that what the general medicine, the practitioner physician or the allopathy guys are recommending. We are not authorized to. Next is cirrhosis. Cirrhosis is a liver cell damage, the chronic liver cell damage that lead to fibrosis. So the hepatocytes, the affected area, they are dead, non-functional. As we have seen, either cases, whether it is alcohol related or non-alcoholic fatty liver, in both the cases, if it is not properly managed, addressed, lead to cirrhosis and or cancer and liver failure also. So here also the autoimmunity causes not only hepatitis but also the cirrhosis. The symptoms commonly in this case, in this stage rather, cirrhosis stage, ascites will be there. That means fluid accumulation in the abdomen. So the stomach will be enlarged with the fluid. That is the common invariably with all the cirrhosis patients, all the severely damaged liver, patients with severely damaged livers, they will have ascites. Jaundice and variceal bleeding, hepatic encephalopathy, that is another condition. Hepatic encephalopathy, severe jaundice and all. Chadjata, when it reaches the brain, causes encephalopathy. It's a serious condition where even the patients will go to coma stage. They will not be oriented. And spider angiomas and all are the symptoms, some of the common symptoms. So they will also, cirrhosis also will cause the portal hypertension. In advanced stage further may lead to liver cancer and end stage liver disease or liver failure or complete. That once cirrhosis means it's irreversible almost because the cells are fully damaged. the hepatocytes. In this picture, this is ascites. So accumulation of liquid on the abdomen. So liver failure, there are two conditions. One is acute and one is chronic. Chronic one due to cirrhosis, and acute mostly because of some sudden infection or the drug induced. So the signs like coagulopathy, blood clotting related, encephalopathy, and multi-organ dysfunction, because this controls the management of toxins in the entire body. So when this is failed to detoxify, the entire metabolic activities in the body will get into a chaos, and the organ which is weak will first fail, and gradually the other organs also one by one, multi-organ dysfunction or failure. Liver cancer, depending upon the location where it is present, whether it is in the bile duct or on the liver itself. So on the liver itself is the common one, that is called hepatocellular carcinoma, HCC. The bile duct cancer, especially if the patient is also having complications with the pancreas as well as the gallbladder, those guys are more prone to have this bile duct cancer. Cholangiocarcinoma. Liver cancer and all, mostly in the case of metastasis, when you see, this will be almost at the end. Now, once liver cancer comes, the metastasis, almost the patient cannot be saved. It's in the very, very advanced stage, because the liver fights very hard to maintain the metabolism and try to detoxify and almost try to support the life of person. So when the liver cancer that led to the almost the entire dysfunction, it's very difficult to uh, revive the condition. So the death rate is very, very high with the liver cancer patients in metastasis. So the risk factors are cirrhosis, hepatitis B or C, aflatoxins, and alcohol. They create or they favor or lead to liver cancer. Common symptoms, cancer in the sense normally weight loss. Even otherwise also, a person who is having any issues with the cancer, the liver, as it influences the appetite. There will be poor or less appetite, no appetite, nausea. So all those things will lead to gradual weight loss. Fatigue will be there. And the right upper quadrant pain. That means on the right hand side, just below the rib cage, it will be tender pain. A mass will be there, and jaundice. Severe cases, irrespective of the nature, whether it is cirrhosis or it is cancer or failure, jaundice will be there, because liver handles the bilirubin, detoxifies that, and sends it to both colon as well as to the kidney to be filtered and sent out through urine and motion. So how the liver cancer is diagnosed is mainly by imaging and then biopsy. Biopsy is the one through which they will confirm whether it is cancer or not. Another less heard disease is hemochromatosis and Wilson's disease. Hemochromatosis is iron overload that leads to liver damage. This is normally seen with the patients like thalassemia, where the patient will have to be transfused with the fresh blood every monthly or bi-monthly, or depending upon the weight and age and condition of the patient. When the splenomegaly is also there. So, premature hemolysis will be there. Premature hemolysis is destruction of RBCs by spleen. So, when splenomegaly is there, enlarged spleen, the destruction will be more. When the RBCs are broken, so iron is released. So, these patients will have excess of ferritin. So, if you check the blood for ferritin, serum ferritin will be very, very high, depending upon the frequency of blood transfusion and also the size of the spleen. So, both are very common in thalassemia patients. What is thalassemia? The patients who cannot produce RBC. No RBC, no hemoglobin. So, they have to depend from external sources by way of transfusion. So, every time you are putting the RBC, normally it has to be there in the body for 120 days. After that only, that will be destroyed by the spleen. Natural process, natural destruction. Instead, in this case, it is a continuous destruction process which is happening before this. That's why it is called premature. Hemolysis is destruction of the hemoglobin, RBCs. This is premature. So, what happens? Every time you keep on transfusing the blood, RBC comes, destroyed by the spleen, and the iron is released in the body. So, the excess iron, Fe, iron, that damages the liver is called hemochromatosis. Similar to iron, if copper accumulation, that is called Wilson's disease. Then biliary diseases. Primary biliary cholangitis. It's an autoimmune condition where the destruction of intrahepatic bile ducts. So the bile ducts are damaged by autoimmune condition. Another one is primary sclerosing cholangitis, where the inflammation of the bile ducts. Next one is cholelithiasis, gallbladder stones, that blocks or interferes with the drainage of the bile secretions, bile juice, by obstructing the duct, especially if the CBD is common bile duct. The report and all, the scanned report and all, you can see CBD. That is blocked, that will lead to very serious complications. First one is jaundice. Then depending upon the condition, other problems, whatever previously we have seen, all those things will come. So that is biliary disease on account of cholelithiasis, gallbladder stone. With regard to TCM's perspective, what is liver or what the TCM says, what pattern, what are all the patterns that causes the problems in the body that we will see now. So as per the TCM, the liver governs the smooth flow of chi. So if any chi stagnation is there, normally we do, take the protocol that, 4 gates, liver 3 and ALI 4, to move, to push, to disperse the chi, so that the stagnation will not be there. So liver governs the flow of chi, and liver stores the blood. It controls the tendons and nails, and we all know that it opens into the eyes. And this influences the emotions, irritability. You see, the anger, stress, these things are sympathetic against parasympathetic. Irritation, anger, and depression, all those things. Before getting into the patterns and all, let us first understand again, already last now session itself we have seen, there is fire, earth, metal, water, wood. So the flow, normal flow of energy, the chi flow. If the wood is having any problem, wood element, we will have to check about the condition of the water invariably. Invariably. Whatever the disease that we have seen so far, as per the modern medicine, most of the conditions, the persons will have any problem related to the water element. So the symptoms can be seen in the water element organs also. For example, in the case of male, either it may be in the kidney, urinary bladder, and then prostate and testis. In case of female, KUB, uterus and ovaries. So there will be some kind of aberration in some of or many of one or two organs of the water element. If the metal started overfiring, bypassing the kidney, here there is no proper flow. That is one condition. Another condition, the metal overfires, influences, controls the wood element, lung and large intestine. You will get to know the symptoms in this. The breathing difficulty, shallow breathing, constipation, stomach bloating, mainly because the apana vayu, it pushes upside the rebellious chi of liver, which flares up and disturbs the function of the lung. That also will be seen. So we need to check which element is involved along with the wood element. If wood element is weak, then automatically the flow of energy chi to the fire will be very less. In such cases, they will have the anger, stress, all the emotional conditions. And in such cases, the heart, because it's the vital one, so autonomous nervous system directly directs the fire element to seek the help of kidney or the water element. So in such cases, this will get into a vicious cycle. What is that vicious cycle? Here, the flow here, it is not there, and due to two reasons. One, there is insufficiency, or second one is overaction of this. So these guys will normally have, besides these emotional conditions, renal stones, scanty urine, and dark urine. In the case of ladies, they will have leukorrhea. Leukorrhea is that white discharge. All those things can be associated with this. So we will have to check when we are making the protocol. Accordingly, we need to make the protocol. There is no one point that for this you just put these points, okay, it's over. Even with the same that vicious cycle of these three, the female persons have to be addressed separately, and male, the approach will be different. Because in this case, lot many the hormonal involvement is also there, are also there, depending upon the age and also the period cycle. That will interfere with the menstrual cycle, because already we have seen that wood stores blood, not only stores blood, the blood flow to the uterus is governed by the liver. So it will get impacted. So we need to check. And some cases, there is a possibility that the spleen or the earth element also will insult the wood element. In such cases, you will get to see the symptoms related to spleen and stomach. If you see the chi, there are predominantly two types. One is congenital, second one is derived or nutritive. This derived chi is food, water, air. So spleen plus lung plus heart, all put together, only that nutritive tissue comes. The involvement of lung also is needed, heart also needed. When the wood is impacted, already we have seen nausea, fatigue, this, that and all. Why here? The involvement of spleen and stomach also are there, and this will also impact that. So the person will become lean, thin, skinny, with big belly, ascites, all those things. So when we see a disease of any organ or the element, you need to see the involvement of all other organs, all other elements. So from where it is coming, and what are all the other elements that got impacted because of this, then only you will be in a position to make appropriate protocol, whether to go ahead with K1 or whether you have to sedate liver 2 so that you can conserve, or you will have to go for the loop connecting with GB 37. So the combination varies, whether it is liver 3 which is GB 37, or here with the spleen 1. So all those points will vary depending upon the condition. So when you approach as an acupuncturist, you need to have, this is not only applicable for the liver or the wood element, for every element the approach must be like this. Now let us see some patterns that are involved. So one is chi stagnation in the liver. So what are the causes? Stress, emotional imbalances, and improper diet that lead to liver chi stagnation. So the symptoms here are the distension in chest and hypochondria, irritability, sighing, and irregular menstruation. So to treat that, we'll have to soothe the liver, regulate the chi, and normally the points in case of liver chi stagnation is Li4 and liver 3, and then GB34 and P6 are combined to clear the flow of qi in the liver. Next is liver fire blazing. So the prolonged qi stagnation that turns into fire, triggered by either alcohol consumption or hot spicy food. So already the qi stagnation is there. These things trigger that into liver fire. This causes headache, red eyes, irritability, bitter taste in the mouth, constipation, and even the skin and all will become almost dry. So normally the point we use here is to sedate liver 2 and then enhance the in part. So you can use L11 with liver 2. That combination acts as the fire engine point, L11 and liver 2. Then GB43, and you can use liver 8 or K1 also along with this. Liver blood deficiency. Blood deficiency is a chronic condition. Maybe due to the loss of blood by way of hemorrhages, mainly in the intestine. So ulcerative colitis or the ulcers, bleeding ulcers. In the case of ladies, menorrhagia. Menorrhagia is the condition where longer duration of menstrual flow, blood flow. Then poor nutrition or chronic illness, some kind of disease or illness for a longer duration, which causes blood deficiency. So the dry eyes, blurry vision, dizziness, scanty menstrual flow, insomnia, even if they are sleeping, no, in between they will get up, afterwards they will find it very difficult to fall asleep again. So what to do? We'll have to nourish the liver blood. So the points we consider here is, of course, UB17. In addition that you can, along with that you can take GB39 also, then SP6, ST36 and liver 8, all the common points. Case of liver indeficiency. Already we have seen fire. Here it is liver indeficiency. That is two conditions. This is yin and yang. Another condition, yin is at same level, but this is flaring up. Another condition, yin is reduced, this is flaring up. And another condition, so now this is related to the indeficiency and yang excess. Here the yin is not deficit, whereas yang is excess. In this case, yang is excess, but N is short. So this case is pertaining to this condition. So the chronic stress or overexhaustion, overwork, or fever and febrile diseases, they will deplete the yin. They will deplete the yin. So automatically this flares up. This is unable to control the yang. So to nourish the liver yin, we'll use liverate, K3 and SP6 are the common points. Liver wind. So there are 3 types in this. Extreme heat generating wind in the case of fever. Liver yang, that causes wind. In case of stroke like symptoms, you can see this. Then liver blood deficiency, that causes wind, that causes tremors in the body. So all these 3 conditions are part of liver wind. But which causes what is the one. So symptoms are tremors is the very common one related to the wind. Then convulsions, then stroke symptoms. So it is related to the movement, whether it is excess or short. So here reduce the wind and strengthen the liver. So we will use liver 3, K1, GB20, especially in the case of convulsions, dizziness, stroke related symptoms and all, we will use GB20. So common general points, if you say what are the points we can use, is liver 3, SP6, ST36. Wherever the chi related issues, invariably you will have to use SP6 and ST36. Liver 3, GB34, liver GB37, and liver 5, that is low and source combinations. That is, if you take liver 3, with that you will go ahead with GB37, or liver 5, GB34. Then shoe points 18, and you can use liver 14, then CB12, P6. These are all the common points. This will vary, fully vary depending on the patients. For that only I have explained you how we need to check. So to summarize, with each condition. So if you see the fatty liver, It is on account of chi stagnation with damp or phlegm as per TCM. This leads to fatty liver condition. So what we'll have to do? So the liver transform or clear the dampness and phlegm. Case of hepatitis, damp heat in liver and gallbladder. So resolve the damp, clear the heat and enrich the liver. In case of cirrhosis, it is on account of blood stasis and chi stagnation. So where chi stagnation is there, over a period of time that will lead to blood stagnation. And spleen or kidney deficiency, that will lead to cirrhosis. So move the blood here, tonify the spleen and or kidney. In case of liver cancer, it is due to the toxic heat, blood stagnation, chi or blood deficiency. So accordingly, we'll have to clear the heat. In case of toxic heat, then resolve the toxins, strengthen the chi, liver chi. Case of autoimmune conditions, hepatitis due to autoimmunity. The indeficiency with internal heat is the cause. So nourish the in and clear the heat. So alcoholic fatty liver, liver fire as well as damp heat are the patterns. So clear the fire, detoxify it and harmonize the liver. Clear the dampness. So how the modern medicine sees and how the TCM views it. Viewpoint wise, for modern medicine it is the organ based one or the pathology or the disease focused. Whereas in TCM, we'll have to consider that in a holistic manner. So the involvement of heart also will be there, spleen will be there, lung will be there, kidney will be there. So we need to check. So it is energy based and it's a holistic one. And test wise, lab test, imaging and biopsy. This is got the modern medicine, and normally we do through our diagnostic tools like pulse, tongue diagnosis and other things, abdominal diagnosis and all. But my advice is that along with our diagnosis, whenever you get any suspicious no triggers, better to go with the tests, whether it is blood test or the imaging also, at least USG, ultrasound, so that you also get to know at exactly what stage the condition is, whether it is in the initial stage or advanced stage, is complicated or any malign condition is there, all those things. So with regard to the strengthening, it is generally modern medicine, it's acute, the condition, acute conditions better with the modern medicine. For chronic conditions, it is TCM is having superiority. Even we have treated so many cirrhosis cases, successfully reversed, where it was told to go for transplantation, liver transplantation. So you can ask any doubts that you have got so far, whatever we have discussed in this. Okay, in case of no doubt, We can close this. Anyone, any doubt so far?